All right, good morning, everyone. I'm here to introduce one of the morning speakers, and they've asked that I keep it brief, so it'll be a very kind of short, punchy introduction. We have Dr. Mary Burke, who is the medical director of the UCSF Trauma Recovery Program and a clinical professor in the UCSF Department of Psychiatry and Behavioral Health. She also provides consultation to primary care at San Francisco General Hospital. And she's here today to speak with us about climate-related mental health issues. And I'll turn it over to Dr. Stuber for the introduction of the second speaker this morning.
Okay, and I am not going to, I have the possibility here of having you connected on 2 or 3 different things. I'm not going to do that because we'd have lots of echoing. I have the privilege of introducing Dr. Chan Park, who is a 3rd-year resident in the UCLA VA Greater Los Angeles residency. She is also a member of the steering committee for Climate Psychiatry Alliance, the Early Career Network, and has been interested in climate change since she was an undergraduate. Without further ado.
Hi, good morning, everyone. Thank you for the introduction. Thank you, Dr. Hilt and Dr. Stuber. So we are thrilled to be here today, and we will discuss climate crisis and its overview of mental health impacts. Next. So I'm a 3rd-year resident here, and I have no healthcare related investment. And we are honored to have Dr. Burke present here with us. So during this talk, we will learn to identify 5 major components of climate change and their impacts on mental health. Next. Okay. And we will, one more next. And we will also learn to understand the disproportionate impacts of climate change on vulnerable populations. Next. And recognize actionable items as mental health providers. So understanding motivation for individuals' work is important. Mine stems from the times I visited Kerala, a southern state of India, to visit my in-law family when the entire airport was flooded due to the storm. Heat in southern India this year increased to 104 degrees Fahrenheit with above 90% humidity. This is extremely dangerous to agricultural workers and other vulnerable populations. Can you go one back? One more back, there. Youth also inspire me in many ways, and it is undeniable that they're impacted by climate change more than ever. Based on the data here, we can see that in majority of youth, climate change affects significant life decisions, such as where they live, where they travel to, and whether they think about having their own kids. So I want all of us at the beginning of this talk today to think about what your motivation is for coming here today and to care about climate change. Next. The first patient I met impacted by climate change was here at UCLA. She was in her 40s who had history of major depression and generalized anxiety disorder, who presented with worsening depression after her beautiful house in LA burned down due to a wildfire. She comes from a well-resourced background with supportive family and had difficult time readjusting to her new suburban home. As I took care of her, I had questions around her diagnosis and whether we can call this PTSD or if climate-related anxiety as a diagnosis will be more befitting. Next. And to put things in perspective, in that year of 2020, over 10,000 structures have been destroyed. And I wondered how people from well-resourced background coped with their losses and anxiety. So I want us to think about what other patients our audience has seen related to climate change throughout this talk. There are 5 major components to climate psychiatry, and we will start with slow-moving disasters as the first step. Next. Based on 2015 Paris Agreement, there are 8 different kinds of slow-moving disasters, including drought, sea level rise, and air pollution. For the scope of this talk, we will focus on drought and air pollution, but other slow onset events such as sea level rise, glacial retreats, loss of biodiversity, and other disasters should not be forgotten, as these are impacting lives in different places of our country and the world. Next. Slow-moving disasters lead to a range of impacts, from anxiety and despair to food insecurity, forced migration, and political instability. Also wanted to introduce the term solastalgia here, as it refers to the process of grieving the ecological degradation, such as us grieving parts of Yosemite after the fire sweeps through. Next. We will begin with drought. UCLA Newsroom published in February that the drought we have been experiencing for the past 22 years is considered as mega drought, which surpassed the drought in the last 1,200 years. It would take multiple wet years to remediate this effect. And yes, we are currently in drought. And due to the drought, the land becomes unproductive and families are left in fragments as thousands of farmers are migrating to overcrowded cities, often leaving women and children behind. The cities become overcrowded, and with these climate refugees, aggravating urban poverty, which leads to food insecurity, loss of employment, massive population displacement, weakening and breakdown of community infrastructure and social connections, which all have major impacts on our mental health. Next. Drought has an impact on ability to produce healthy food and our nutrition, including vitamins. And they're profoundly affected by drought conditions, which has an impact on our brain development and cognition. Next. Air pollution has numerous contributing causes, and burning fossil fuel, as many of you may have heard already, is the most significant contributor to air pollution. The impact of pollution on life expectancy is comparable to that of smoking, almost 3 times that of alcohol and drug use and unsafe water, 5 times that of HIV and AIDS. Therefore, if you think about the policies that limit CO2 emissions, they have a co-benefit of also improving health risks. And air pollution, just like climate-related disasters, they don't affect people equally. Vulnerable populations of medically ill, elderly, and children will experience higher burden, and children will experience even more restricted outdoor activity, and this will lead to anxiety and distress. Next. We all know that air pollution has impact on cardiovascular and pulmonary function, but what is more remarkable in our field of mental health is that air pollution has impact on our brain function. And those tiny, tiny particles of 2.5 micrograms, they not only get to the brain through our circulatory system, but as we breathe directly through our olfactory apparatus, they cause inflammation and oxidative stress that have profound impact on fetal development and on different life cycles and stages. Next. And what you see here, the list, these are the examples of the neuropsychiatric health risks in different life stages, as you can see, from lower IQs and smaller brain volumes all the way to dementia and depression. And what is important to note here is that these don't stand alone as a risk, as a causative risk, but that these are multipliers in individuals with pre-existing risk conditions. Next. So next, we will discuss acute disasters associated with climate change. So acute disasters such as hurricanes, tornadoes, and wildfires have profound impact on mental health outcomes. And as you see on the right side, the health risk behaviors that result from acute disasters include increased substance use, smoking, increased interpersonal abuse, and child abuse and neglect. Next. There are different types of acute disasters depending on locations, like wildfires, hurricane, tornadoes, and severe storms are also increased in geographic range and intensity. For the purpose of this talk, we will focus on wildfires. Next. One more. Okay, so these numbers are based on California wildfires. When I reviewed the records of the acres burned due to wildfires, rarely in history until recently did we go over 1 million acres. However, in 2021, we went over 2 million acres, a huge jump equivalent to the size of Delaware. Next. In January, at the beginning of 2022, we have burned 723 acres. And next. And when I checked again in July, that number increased to over 22,000 acres. And it's good to remind us that we are more than halfway through the year now. And as many of you know, the wildfire in California is raging at this time. Next. So the point that I would like to drive home today is that wildfire season is starting earlier, lasting longer, and it is more extreme. Drought, extreme heat, and reduced snowpack are contributing factors to the severity of the fires. These are interconnected as nothing stands alone in the realm of climate change. As we are balancing what is ahead of 2022, we also need to recognize compassion fatigue and new baseline for acceptance around wildfire statistics and our unfazed attention to the media coverage of wildfire. When thinking about wildfire, it's important that we think about vulnerable population. So for instance, in 2018, Paradise Fire in California, the fire demolished 18,000 homes. And with these disasters, our homeless population increases. And people who have never experienced homelessness are now experiencing it. And this increases tension between already homeless population and recently displaced folks over limited resources. One more, next. Elderly populations are extremely vulnerable to disasters, and most of the people who died during the Paradise Fire were elderly individuals, and they're more susceptible to cognitive impairments, and we know this from taking care of our geriatric patients. Also, when people face traumas like wildfire, it is possible for people to come out of the experience and be able to move on with their lives, especially when they have access to influencing factors that you see here on the upper left-hand corner. So this is from a paper published in 2019 Hayes article, which listed the factors that influences how people process the impacts of climate disaster psychologically. So for example, access such as financial and physical access during and after extreme weather disasters play a significant role in mental health consequences. But the loss of community, supply chain interruption, loss of service, breakdown of health delivery system will impact the outcome of mental health negatively. Next. So next, Dr. Burke will discuss the extreme heat and other topics.
Thank you, Dr. Park and Dr. Helt, for inviting me to join this conversation. I want to speak to you from my clinical experience as the medical director at the TRC, where our clients include asylum seekers, especially from Central America, victims of crime, including intimate partner violence and rape, and collateral victims of homicide. I don't screen for climate-related trauma when I do my evaluations, but I know that climate and environment impact our patients directly through the impacts that I will be discussing. I also make sure to discuss heat, medications, the environment, and health with every patient. And in addition, I consult to a community group that is building neighborhood resilience in the face of the combined stresses of environmental degradation and toxic stress. This is an overview of heat impacts on mental health, including increases in mood instability with increased violence and suicide. And perhaps the easiest thing for us all to remember is increased toxicity of psychotropics and other medications. Epidemiological studies are clear that higher temperatures increase violence, as these examples show. 2 studies in the United States showed a 4.5% increase in sexual offenses and an almost 10% increase in intentional homicides with 5-degree increase in temperature. And a study in Japan showed that emergencies due to assault increased linearly with temperature rise in Japan. The molecular mechanisms for these findings are still not elucidated, as this Finnish study showed. Researchers did a 2-track study where they looked at public health data for increases in violent crime with extended heat waves, as well as peripheral, that is platelet serotonin receptor density, correlating with heat in normal controls and violent offenders. And as the diagram on the right shows, there was a mild and non-significant drop in serotonin receptor density in controls, but quite a steep drop in violent offenders with a 1-month lag, and a higher rate of crime with lower platelet density. And then in a public health axis, we have increased violent crime with increased temperature. There are a number of public health studies that correlated deterioration in health and mental health with heat, as shown by the following 3 studies. A 9-year study in California showed that heat waves increased ER visits by almost 5% in the warm season and over 5.5% in the cool season. And so we note it's not absolute temperature, it's relative increase. Similarly, in Vietnam, the heat wave is 95 degrees at 7 weeks, with a significant increase in relative risks for mental health disorders. And finally, a joint study with Mexico and the United States showed a rise in suicides, even with a 1 degree Fahrenheit temperature increase. And on the right, we have an illustration from that study. Again, maybe the most important thing for us to remember after today is that psychotropic medications plus heat increase risk. And there are different mechanisms, including increasing metabolism, so that's stimulants and MAOIs, impairing central thermoregulation, perhaps at the hypothalamus, and that's antipsychotics, reduced sweating, so that's all of our anticholinergic meds, vasoconstrictors, tricyclics, and antipsychotics. We all know that dehydration can make lithium toxic, and propranolol, which we also use frequently, enhances sweating, so we don't see a temperature rise, but we need to remind our patients to replace those lost fluids. And here's a comprehensive list of drugs known to disturb thermoregulation in the slides. I'm assuming will be available after the talk. And this is where we need our bench research. Everything seems to point to serotonin, but we don't have all of the mechanisms fully understood or how to balance the need for medications with the heat risks. One basic science research looked at serotonin syndromes, heat, and rats, where researchers found that heat increased the risk of serotonin syndrome while cooling reduced it. And what they found was that under conditions of heat, increased intracerebral serotonin increased the sensitivity of downstream serotonin receptors, leading to yet further downstream, enhanced release of more serotonin and glutamate, triggering more serotonin release. So here is a picture of that. And here we have the dorsal raphe nucleus communicating with the periorbital anterior hypothalamus and instructing it to release serotonin, and also with the prefrontal cortex instructing it to release glutamate, which then stimulates the NMDA receptors, increasing serotonin release. And the populations at greatest risk, as Dr. Park has said, include the elderly, pregnant women, infants, and children, the unhoused, those who work outside, including agricultural workers, laborers, and first responders, those whose ecosystems are changing rapidly, those who live in urban heat deserts, and those in the global south. And this picture, courtesy of the Columbia Center for Climate Communication, shows that indeed those of us in the global north have a better prognosis for climate resilience, which is a good segue for the topic of environmental justice. Numerous studies across disciplines clearly show that climate change is a risk and inequity multiplier with those in the global south, the poor, and BIPOC residents of the global north most affected. And remember, it's not just the heat, the environment is everything. So heat, environmental degradation, and political and social decision-making are synergistic. I have to take a slide to talk about green spaces based on my work in the Potrero Hill public housing, which is shown in this picture in the foreground. For many years, the public housing, which was built to be segregated from the rest of San Francisco, downwind from the Morant power plant, where residents were affected by the constant emissions. When the power plant closed, remediation was given, and that's how I became involved with the Healthy Generations Project. And you can see that they are on a hill, very inconvenient to walk around. There's one meandering bus line, and these are non-native trees sort of perched behind them, and there are no grocery stores. Compare that to this beautiful greenery in the affluent Pacific Heights neighborhood next to the Presidio Park. We know that green spaces reduce ambient temperatures, protect birth outcomes through various mechanisms, protect against mental and cardiovascular disease, but in the United States, we have a long tradition of redlining that has reduced green spaces in urban and predominantly minority neighborhoods with an increase in heat. This is a scary map from Cal EnviroScreen, just to remind us where some of the toxic areas are in our state, and just to review some of the material Dr. Park has mentioned in detail. Common toxins, including lead, mercury, PCBs, and pesticides, all contribute to developmental toxicity. Lead famously increases aggression and impulsivity. Nitrates have been linked to Parkinson's disorder, and this is actually an ongoing UCLA study. Under conditions of drought, there's a concentration in the soil and the water of contaminants. Drought also dries soil, which creates toxic dust, which is then churned up by agriculture. And that dust also contains coccidioides. And UCSF has done a study looking at the spread of coccidiomycosis in the state. Finally, proximity to freeways and industry, and remember that picture of Potrero Hill right next to the 280 freeway, increases exposure to PM 2.5, which Dr. Park has already discussed. And a moment to just remember that it's especially mothers and parents of children with developmental disabilities who then must shoulder the emotional burdens of raising children with special needs. And now moving on to climate refugees. The IPCC estimates that between 25 million to 1 billion people will be displaced by 2050, and especially from the global south. So they are bearing the burden of the northern carbon emissions. As Dr. Park has mentioned, environmental damage is often the precipitant for chronic civil war. and the Syrian Civil War is perhaps the most famous example, where a combination of government policies and drought led to movement into already crowded urban settings, the beginning of protests and civil unrests. And after the so-called Arab Spring, there has been a relentless war. And in one study in Britain, over half of Syrian refugees there reported clinical post-traumatic stress disorder. For those of us who practice in California, the impact of climate change on Central America is closer to home. And in 2020, hurricanes Eta and Iota hit Honduras, Guatemala, and El Salvador after 5 years of hurricane activity. At least 500,000 people have been estimated to be displaced in Central America, with consequences including flooding, landslides, loss of farmland, infrastructure, and drinkable water. This slide speaks for itself, with the trauma of migration compounded by violence at the border. And in 2018, I spent a week as a volunteer at the now infamous Dilley Detention Center south of San Antonio, assisting asylum evaluations. I had a chance to hear firsthand from mothers the horrible experience of having their children taken from them at the borders. Moving from here to the topic of eco-anxiety or ecological distress. There have been a number of named eco-distress syndromes, or responses to our changing environment. Eco-anxiety and climate grief, solastalgia, as Dr. Park has mentioned, just feelings of existential risk. And researcher and writer Britt Ray talks about soft denial, the compartmentalization that all of us use probably almost every day to continue our more comfortable lives while aware of the threat that is looming over us. And remember, eco-anxiety is not pathology. It's listed in the Oxford Dictionary, but not in the DSM. It's been described as oscillation between states of numbness and feeling overwhelmed with intrusive experiences. For those of us who need to build, there are V and Z codes, including lack of safe food and water, and in ICD, occupational exposure to toxins. This slide, this study from 2021 by Hickman et al. From Lancet Planetary Health got a lot of press attention. 10,000 youth from 10 nations responded on questions about the climate, and 60% reported feeling worried or extremely worried. 3/4 thought the future was frightening, and over half thought humanity was doomed. Most strikingly, more than 45% said their daily functioning was affected. Often left out of the mainstream coverage of this article was the punchline, which is it wasn't just the climate, it was the perceived inadequate government response and feelings of betrayal. So what do we do about it? Because as we always tell our patients, taking meaningful action reduces stress. Remember those heat and dehydration warnings for our patients taking these and other medications. I also provide anticipatory guidance as we get into heat waves for those who have risks for self-harm or aggression. I do this much the way I would for those who have anniversary reactions they're worried about. Also engage in problem solving and planning regarding cooling. This great infographic is available for free from the Climate Psychiatry Alliance in English, Spanish, and Mandarin. And you can get it at this website. Make sure you're planning ahead for fires with your patients, including HEPA filters and N95 masks. And a recent study has indicated that HEPA filters may also be protective for pregnant mothers and fetuses. An emergency supply, medications, phone charger, etc., can all help with anxiety. There are a number of psychotherapies that have been tested in situations of climate disasters and forced migration. These include psychological first aid, which was deployed in Puerto Rico after Hurricane Maria, interpersonal therapy, and the WHO, in fact, has a manual for interpersonal therapy to be used in refugee camps, cognitive behavior therapy and trauma-focused CBT, acceptance and commitment therapy, and I think most interestingly, peer-led interventions using these techniques. Other things to consider include getting an environmental history. So for children with disruptive behaviors and learning disorders, and for pregnant women, especially those in potentially toxic neighborhoods. And free information and toolkits can be found through the Pediatric Environmental Health Specialty Units and the Program for Reproductive Health in the Environment. The Cal Enviro screen can tell you what toxics to look for and where. It's helpful for our patients to re-engage them in their community to combat feelings of isolation and helplessness. So that includes neighborhood emergency response training, CPR training, connecting with gardens and food banks, and of course, cooling. And if you're working in an inpatient or carceral setting, such as a prison or jail, communicating with your administration on air quality and temperature control are vital. We talk about the care model for academic institutions, and that includes clinical action, administrative participation, and you can learn about that through Healthcare Without Harm, which helps reduce the carbon footprint of hospitals and clinics. Advocacy, because nurses and doctors are two of the most trusted voices, research and education. Many of you may already know about the UC-wide Center for Climate Health and Equity. So consider getting involved there, and this is the website. And remember self-care for ourselves and for all our patients. Things that we say probably every day. Sorry for the noise. And in particular, remember the media diet and the practice of a mindfulness or equivalent. And for me, that means connection with nature. The stories that we tell influence how we decide. And in the US, we have a heavy cultural bias to nihilistic, violent endings like the Mad Max story. But there are other stories that are just and in balance with the planet. So I'm going to close with a quote from the brilliant writer Octavia Butler, who in 1994 wrote the Parable novels set in 2024 that looks an awful lot like the future that we are heading into. There seem to be solid biological reasons why we are the way we are, but we can do something no other animal species has had the option to do. We can choose. We can go on until we either destroy ourselves or destroy the ability of our world to sustain us, or we can make. And now I'm going to turn it back to Dr. Park.
When I talk about climate change and climate psychiatry, people often ask, one before, thank you. People often ask, well, what can I do about climate change? And in reality, the topics that contribute to climate change are so widely ranged. So I wanted to share some resources here. So starting with the right side, there are physician-led organizations such as Climate Psychiatry Alliance or Climate Health Now, that if you're into advocacy and would like to join the effort, you can join these organizations. Also, if you'd like to start with educating yourselves and learning about how climate change impacts mental health, if you just Google or go on YouTube, starting from the left is Dr. Robin, you can find talks by Dr. Robin Cooper, who's the head of our Climate Psychiatry Alliance, the Jeremy Wurtzel, who writes, also psychiatrist, early career psychiatrist who writes children's books. And there are other recorded conferences and the seminars and talks that are very easily and widely available. And last but not least, this is a fantastic podcast called How to Save a Planet. And It's a very witty podcast that delves into a wide range of topics related to climate health. And they range from, like, if you read the table of content, first one is like, can the World Cup in Qatar really be carbon neutral? To you feeling doomed and like how to tackle climate anxiety. And some of the previous topics I listened to are fishing versus kelp farming, indigenous population and their efforts around climate change, talking about Dakota pipelines, and can electric cars can really help contribute positively to the environment. So everybody's interests are different, and this podcast has actionable items attached to every single episode. So if you're interested in taking an action based on your interest, I wanted to put a plug in for this. Next.
So we have some questions in the chat, and maybe Dr. Park, you and I can take turns answering them. So I will read them, and let's see. The first one is from Diana Luxembourg. How can you not mention lack of logging in areas that have been logged, which in areas that have been logged has saved lives? Lack of logging has exacerbated the amount of fuel and intensity of the wildfires. And the stats appear off.
So thank you for your question. I can try to take a stab at this. So when you look at, there are many different data points and historical facts and around the climate change. And I think individual data points may point to various directions. But the point that we're trying to get across in this talk is the overall picture of what we are experiencing right now, the severity of the drought, the storms that we're seeing, the flooding in other parts of our country. These are overall considered to be contributed by human efforts, and raising awareness and discussing around these are our goals and the direction we want to head it off. But absolutely, I'm sure that the statistics around the loggings, there are many of them, and I want to make sure that we get the overall picture of what we are, in what direction we are heading together.
And the second question is that there was worse pollution in London in the 1800s, and why wasn't there more autism? And the French have also been diagnosing since the 1700s. And the percentage hasn't really changed. I don't know, I've never seen stats for mental health diagnoses in London in the 1800s, but I also think there was very little interest in the mental health of the poor who would be most affected by air pollution back in London in the 1800s. And looks like Dr. Helt would also like to answer this question live. So I know that I will turn it over to you, Dr. Helt. I will say I've seen many studies that show an increase in autism over the last 2 decades. Dr. Helt, did you want to answer that question?
Oh, I think he already answered in the chat, but that's his way of just keeping track of the info. He's not answering, so we can just keep going.
Yeah.
I can answer the next one. It says, what is meant by cultural relevancy in the context of resilience factors? I think you were talking about one of the slide had the resilience factors on the upper left-hand corner. And there, the cultural relevancy means the ways that we as a society provide intervention for these climate disasters, and the interventions and the support that we give to people or victims who are suffering from climate disasters should be culturally appropriate and actually be meaningful to these people who are receiving the aid and for who they are. That's what that means.
Hi, I just was going to address Dr. Hansen's question about the increase in violence. And I think clearly there are a lot of social factors, but what's been studied and noted is when all other conditions remain the same, there is still an increase in violence. and in different settings, urban and rural, and internationally. And Dr. Park, there was a study about self-care. How do we work with our own vulnerabilities while providing clinical support to others? And that's something you really thought a lot about.
Sorry, so I think that's the question from Kate Sheehan. Like our experience with COVID, climate change impacts us as well as our client. How do we work on vulnerabilities while providing clinical support to others? That's a very good question. And I think tuning into, I mean, it sounds like a very generic answer, but tuning into our own interests and who we are and what our triggers are, and always helping us first before stepping into the things that we can do, and ensuring that we are okay before going on to other disasters and learning about the things that we can do. I think first assessing who we are is the first step. Dr. Burke, did you want to add anything to that?
No, I'm responding to a question about how we as physicians can bring about policy change.
Okay.
I'm sending it as an email, as a chat, but I also want to talk about the organizations you've talked about. The Climate Psychiatry Alliance is very active. Climate Health Now is very active, and the Medical Consortium for Climate and Health all have major voices, which includes lobbying and training on how to lobby. So I would definitely check out the Medical Consortium for Climate and Health. They have a great annual conference.
Yeah, I think that helps answer both Dr. O'Connor and Kalofano's questions, that our efforts around political lobbying are going on, and we really need greater momentum and people joining the forces. So I think joining Climate Health Now and CPA can definitely give you more specific guidance.
And I'm going to answer Dr. Semel's question about positive deviance and creative solutions. And I think that's where it's really important to curate what media you're taking. There actually was a June 2022 issue of Science magazine, which was filled with sort of what future do we choose, and a lot of positive solutions. There are the How to Save a Planet is fantastic. And also the Elizabeth Diana Johnson, who's the host of that, Diana Elizabeth Johnson, who's the host of that podcast, has edited a book called All We Can Save. And there are a number of really exciting things going on.
I can actually give a few examples that I learned as well. They also talk about this Yurok tribe, an indigenous tribe that has had most of their indigenous land taken away to the US government. What they actually ended up doing is they started planting more trees, and by selling their carbon credit, they turned planting trees into a profitable business. And with the money, they were able to buy more of their lands back, of their native lands. And this selling of the carbon credits to the companies and working with them has become their major resource for revenue generating for their community. That is one creative positive solution I've heard. Another one is kelp farming. So fishing industries can also do lots of harm to our marine biology and ecology. If you think about how much oceans constitutes on the planet, the World War II technology of fishing and dumping of the fishing nets have also impacted the ecology negatively. And kelp farming has actually been a creative and positive solution to what has been going on. And they also have another, if you're interested, there's also another episode about algae and how algae can give us hope and creative solutions around how to save our planet. So there are tons of them. We just have to be tuning in to these topics.
I wasn't sure whether you saw the chat message from Kate Sheehan.
Yes, the chat, that's separate from the Q&A.
Yeah, that's question for separate. I can just read it, but and we've got another question. Okay, but it's just sharing the resource of the carbonalmanac.org, the Carbon Almanac for adults and free one for kids as well.
There's also a nice app called Earth Hero, in which you can sort of put in various aspects of your personal habits, and it'll show you ways that you can reduce your personal carbon footprint. I need to see.
Awesome. I do want to say that, when we're talking about climate change and how it affects our field of mental health, it is such a broad topic. And as these questions and Q&As that are coming in represent the diversity of the interest and where our headspace is, this is just the beginning of a conversation. And I'm really glad that discussion is taking place. And it is up to us individually, where do we take this, our questions and our curiosity to the next place.
So again, just to remind everyone that there are a number of resources listed in these last slides, and I'm assuming that these slides will be available for the UCLA audience. So have some fun looking through them, and these are things that work. Remember to remind your patients about the medications and heat. Thank you very much for the invitation.
Thank you so much for speaking to us. And yes, for people who aren't familiar, we record all of these presentations, and so they are available to watch later on YouTube. So thank you to both of you for what is a very timely presentation.
Goodbye. Thank you.
Goodbye.
Thank you.